Hi, my name is Kris Stroud, and I work with Michigan State University Health Sciences. My role is a strategic integration manager, and in that role, I provide strategic and operational leadership around the areas of analytics, workflow improvement, system implementation, and really whatever our executive management team wants me to focus on. I've worked in higher ed for most of my career, background in analytics and business intelligence, and working in the business office of a health college. Health Sciences is an organizational unit that supports our health colleges at Michigan State University, which includes the College of Osteopathic Medicine, the College of Human Medicine, and the College of Nursing, as well as our patient-centered Healthcare Inc. entity. And we really are focused on collaboration, excellence, and access to care in that role. The problem that we were trying to solve in this situation was to replace an existing system that was used to capture educational assignments within the College of Human Medicine. But we were thinking more broadly than just simply replacing that tool. We were looking at how we could expand that to the other units that Health Sciences supports. That particular tool helps us to capture what the teaching hours are associated with the shared discovery curriculum. It allows us to answer business questions as it relates to how many faculty we need, what is the educational FTE calculated based on the number of assigned hours, what are the departments that are contributing to our educational mission. The existing system had 5 years of historical data, so it was essential that we were able to retain that data and to transition to a system that would not only lift and shift the existing product, but provide a better user interface and more flexibility, and be scalable to potentially rolling out to the College of Osteopathic Medicine, the College of Nursing, or other entities at Michigan State University. The system will allow us to plan, assign, and report on educational assignments for the shared discovery curriculum of the College of Human Medicine. As we replaced the educational assignment system, we not only wanted to transition to a new platform, but to improve the user experience by increasing capabilities with the reporting environment. I first became familiar with True as being a member of the RFP committee at Michigan State University when we were selecting a tool for university planning. And I had an opportunity to learn from the team, their experience. And then as we went through that process of implementation of the university tool, I was able to see the successes that were there. When we were deciding on a vendor, it was a natural choice for us. Given the success that the project had had, the team was already familiar with Michigan State and had relationships with our central team, so it was a natural selection for us. It was very easy given their existing professional relationship with Michigan State, especially when it came to user accounts and familiarity with our enterprise data hub and how to access that information in Teams. I would say there were good surprises. We were able to explore additional functionality that didn't exist in the current system. We've been able to apply additional business intelligence tools on top of the data set that was created. The team offered insights and suggestions that we wouldn't necessarily have thought of given their experience with Anaplan. And overall, it was exciting to be a part of the discussions and coming up with new ways to create a better experience for our end users. One of the great benefits was our undergraduate medical education administrative team previously was not able to do certain administrative functions. That required more technical expertise. The way the new system is designed has really empowered that end user to do the work that she needs to do without roadblocks. So role-based security that was baked into the system really has helped us, as well as the additional reporting capabilities using not only Anaplan but external tools to customize reports without having to necessarily have the expertise in Anaplan. That has been great. We are looking forward to rolling out this system to other colleges across campus. Of course, as I mentioned, the health colleges initially, and I'm excited to see what their benefits will be. So I am very pleased to say we had a successful implementation. We just rolled out our academic year plan for the 25-26 year, and we have over 60,000 academic hours scheduled with the tool that calculates to over 37 faculty members in terms of an educational FTE, and it's actually over 300 individual faculty members that received their educational assignments from the system. If I had to pick one word to describe our experience with True, it would be successful. So I would say my experience working with True, that what stood out to me is different is very hands-on approach. Their experience working with higher ed stood apart. We didn't have to take as much time to get them up to speed, and they were able to get right to work. Our consulting team was very supportive, and what I really appreciated about them is I could present a requirement and talk through what we were trying to accomplish, and they would proactively provide solutions, potentially prototype a couple different options that we could talk through together and get a game plan for how to best meet that. I can think of a number of ways I would love to engage with True in the future. What comes to mind initially would be rolling out the educational assignment system to other organizations on campus, so working with them to discover what their curriculums look like and how that can fit into the model that we created. Beyond that, I have lots of ideas for effort reporting and source and use alignment with funds flow. If an organization's on the fence about going with True, I can say with certainty you will not regret hiring this team and working with them.